Many students fail the Nclex not because they don't know the content, but because they choose the wrong patient first. In this video, we're breaking down 50 who should the nurse see first priority questions that test ABCs, acute versus chronic, unstable versus stable, and life-threatening cues, exactly how the Nclex loves to ask them. Each question is clinically accurate, exam-focused, and explained in a simple Nclex way so you can stop guessing and start thinking like a nurse. Watch till the end because these priority questions can be the difference between passing and failing the Nclex. Let's get started. Question 1. Which client should the nurse see first? A. A client with chronic asthma requesting a PRN inhaler. B. A client with diabetes reporting blurred vision. C. A client with chest pain radiating to the left arm. D. A client with hypertension due for scheduled medication. Answer C. Chest pain with radiation suggests acute coronary syndrome and is life-threatening. Question 2. Which client requires immediate nursing attention? A. A post-operative client with pain rated 6 out of 10. B. A client with a new onset of confusion and slurred speech. C. A client waiting for discharge instructions. D. A client requesting assistance to the bathroom. Answer B. Sudden neurologic changes indicate possible stroke and require urgent intervention. Question 3. Which client should the nurse assess first? A. A client with blood glucose of 180 milligrams per deciliter. B. A client with nausea after chemotherapy. C. A client with a respiratory rate of 8 minutes per minute. D. A client with mild headache. Answer C. Bradypnea threatens airway and ventilation and is the top priority. Question 4. Which client should the nurse see first? A. A client with heart failure reporting ankle edema. B. A client with COPD using accessory muscles to breathe. C. A client with controlled atrial fibrillation. D. A client requesting pain medication. Answer B. Use of accessory muscles indicates respiratory distress and impending failure. Question 5. Which client needs immediate assessment? A. A client with fever of 38 degrees Celsius or 100.4 degrees Fahrenheit. B. A client with potassium level of 6.2 milliequivalents per liter. C. A client with constipation. D. A client with anxiety. Answer B. Severe hyperkalemia can cause lethal cardiac dysrhythmias. Question 6. Which client should the nurse see first? A. A client with hypoglycemia who is awake and alert. B. A client with DKA and fruity breath. C. A client with type 2 diabetes needing insulin teaching. D. A client with glucose of 250 milligrams per liter. Answer B. DKA is a medical emergency requiring immediate treatment. Question 7. Which client is the highest priority? A. A client with post-operative nausea. B. A client with stridor after thyroid surgery. C. A client with pain at the IV site. D. A client requesting antiemetics. Answer B. Stridor indicates airway obstruction and is life-threatening. Question 8. Which client should be seen first? A. A client with a pressure injury, stage 2. B. A client with sudden shortness of breath and chest pain. C. A client with controlled pain. D. A client awaiting lab results. Answer B. Sudden dyspnea and chest pain suggest pulmonary embolism. Question 9. Which client requires immediate attention? A. A client with urinary retention. B. A client with abdominal pain after meals. C. A client with decreased level of consciousness. D. A client with mild dizziness. Answer C. Altered LOC indicates compromised cerebral perfusion or oxygenation. Question 10. Which client should the nurse see first? A. A client with vomiting and diarrhea for 2 days. B. A client with hypotension and tachycardia. C. A client with controlled nausea. D. A client with constipation. Answer: B. Hypotension with tachycardia suggests shock. Question 11. Which client is the priority? A. A client with Foley catheter leaking. B. A client with sudden severe headache. C. A client with stable angina. D. A client requesting food. Answer: B. Sudden severe headache may indicate intracranial hemorrhage. Question 12. Which client should be assessed first? A. A client with mild wheezing. B. A client with oxygen saturation of 86%. C. A client with controlled hypertension. D. A client with insomnia. Answer: B. Oxygen saturation below 90% indicates hypoxia. Question 13. Which client needs immediate care? A. A client with post-op pain. B. A client with chest tube drainage of 50 milliliters per hour. C. A client with absent breath sounds on one side. D. A client with low-grade fever. Answer: C. Absent breath sounds suggest pneumothorax. Question 14. Which client should the nurse see first? A. A client with anxiety before surgery. B. A new onset seizures. C. A client with nausea. D. A client requesting water. Answer: B. New onset seizures require immediate evaluation. Question 15. Which client requires priority intervention? A. A client with elevated blood pressure. B. A client with sudden vision loss. C. A client with mild headache. D. A client with chronic back pain. Answer is B. Sudden vision loss may indicate stroke or retinal detachment. Question 16. Which client should be seen first? A. A client with asthma who ran out of inhaler. B. A client with audible wheezing and cyanosis. C. A client with stable oxygen needs. D. A client with cough. Answer is B. Cyanosis indicates severe hypoxia. Question 17. Which client is the top priority? A. A client with nausea. B. A client with uncontrolled bleeding. C. A client with pain rated 7/10. D. A client requesting repositioning. Answer is B. Active bleeding threatens circulation. Question 18. Which client should the nurse see first? A. A client with fever after surgery. B. A client with sudden drop in blood pressure. C. A client with constipation. D. A client requesting discharge papers. Answer is B. Sudden hypotension suggests shock or hemorrhage. Question 19. Which client requires immediate care? A. A client with nausea after morphine. B. A client with shallow respirations after opioids. C. A client with itching. D. A client with dry mouth. Answer is B. Opioid-induced respiratory depression is life-threatening. Question 20. Which client should the nurse see first? A. A client with chronic kidney disease. B. A client with acute confusion and fever. C. A client with controlled pain. D. A client with insomnia. Answer is B. Acute confusion with fever suggests infection or sepsis. Question 21. Which client is the highest priority? A. A client with vomiting. B. A client with Kussmaul respirations. C. A client with fatigue. D. A client with headache. Answer is B. Kussmaul respirations indicate metabolic acidosis, DKA. Question 22. Which client should the nurse assess first? A. A client with a new rash. B. A client with tight chest and wheezing. C. A client with mild pain. D. A client requesting snacks. Answer is B. Tight chest and wheezing indicate airway compromise. Question 23. Which client needs immediate attention? A. A client with low urine output. B. A client with severe abdominal rigidity. C. A client with nausea. D. A client with constipation. Answer is B. Abdominal rigidity suggests peritonitis. Question 24. Which client should be seen first? A. A client with fever and chills. B. A client with sudden onset hematuria. C. A client with hypotension and altered mental status. D. A client with back pain. Answer is C. Hypotension with altered mental status suggests septic shock. Question 25. Which client is the priority? A. A client with sore throat. B. A client with drooling and difficulty swallowing. C. A client with nausea. D. A client requesting pain medication. Answer is B. Drooling and dysphagia indicate possible airway obstruction.
Question 26. Which client should the nurse see first? A. A client with asthma who is stable. B. A client with anaphylaxis symptoms. C. A client with itching. D. A client with mild wheezing. Answer B. Anaphylaxis is a medical emergency affecting airway and circulation. Question 27. Which client requires immediate care? A. A client with diarrhea. B. A client with severe hypotension after trauma. C. A client with pain. D. A client with nausea. Answer B. Hypotension after trauma indicates hemorrhagic shock. Question 28. Which client should be seen first? A. A client with vomiting blood. B. A client with mild nausea. C. A client with headache. D. A client requesting water. Answer A. Hematemesis indicates active gastrointestinal bleeding. Question 29. Which client is the priority? A. A client with elevated temperature. B. A client with sudden onset chest pain and dyspnea. C. A client with constipation. D. A client with insomnia. Answer B. Chest pain with dyspnea suggests myocardial infarction or PE. Question 30. Which client should the nurse assess first? A. A client with urinary frequency. B. A client with new onset atrial fibrillation and hypotension. C. A client with controlled pain. D. A client with nausea. Answer B. Unstable dysrhythmias compromise cardiac output. Question 31. Which client requires immediate intervention? A. A client with sore throat. B. A client with epiglottitis symptoms. C. A client with mild cough. D. A client requesting medication. Answer B. Epiglottitis can rapidly obstruct the airway. Question 32. Which client should the nurse see first? A. A client with anxiety. B. A client with signs of stroke. C. A client with nausea. D. A client with fatigue. Answer B. Stroke symptoms require rapid intervention to preserve brain tissue. Question 33. Which client is the highest priority? A. A client with mild asthma symptoms. B. A client with respiratory arrest. C. A client with cough. D. A client with fever. Answer B. Respiratory arrest is immediately life-threatening. Question 34. Which client should be seen first? A. A client with constipation. B. A client with cyanosis and low oxygen saturation. C. A client with headache. D. A client with nausea. Answer B. Cyanosis and hypoxia require urgent intervention. Question 35. Which client needs immediate attention? A. A client with hypoglycemia who is unconscious.
B, a client with mild hyperglycemia, C, a client with fatigue, D, a client requesting food. Answer A. Unconscious hypoglycemia threatens airway and brain function. Question 36. Which client should the nurse see first? A, a client with controlled pain, B, a client with sudden severe back pain and hypotension, C, a client with nausea, D, a client with fever. Answer B. Sudden back pain with hypotension suggests aortic aneurysm rupture. Question 37. Which client is the priority? A, a client with mild muscle pain, B, a client with sudden onset confusion, C, a client with headache, D, a client with insomnia. Answer B. Sudden confusion indicates acute neurologic compromise. Question 38. Which client requires immediate care? A, a client with vomiting, B, a client with severe dyspnea and pink frothy sputum, C, a client with cough, D, a client with mild fever. Answer B. Pink frothy sputum indicates acute pulmonary edema. Question 39. Which client should be seen first? A, a client with anxiety, B, a client with sudden abdominal pain and rigid abdomen, C, a client with nausea, D, a client requesting discharge. Answer B. Rigid abdomen suggests perforation or peritonitis. Question 40. Which client is the highest priority? A, a client with chronic pain, B, a client with severe burns and hypotension, C, a client with mild fever, D, a client with nausea. Answer B. Burns with hypotension indicate shock. Question 41. Which client should the nurse see first? A, a client with sore throat, B, a client with sudden loss of consciousness, C, a client with mild dizziness, D, a client with fatigue. Answer B. Sudden LOC suggests life-threatening neurologic or cardiac event. Question 42. Which client requires priority care? A, a client with headache, B, a client with signs of spinal cord compression, C, a client with nausea, D, a client with constipation. Answer B. Spinal cord compression can cause permanent damage. Question 43. Which client should be assessed first? A, a client with controlled asthma, B, a client with choking and inability to speak, C, a client with cough, D, a client with sore throat. Answer B. Inability to speak indicates complete airway obstruction. Question 44. Which client is the priority? A, a client with nausea, B, a client with severe allergic reaction and swelling, C, a client with rash, D, a client with itching. Answer B. Angioedema threatens the airway. Question 45. Which client should the nurse see first? A, a client with constipation, B, a client with sudden chest pressure and diaphoresis, C, a client with headache, D, a client requesting water. Answer B. Chest pressure with diaphoresis suggests myocardial infarction. Question 46. Which client requires immediate attention? A, a client with vomiting, B, a client with signs of sepsis, C, a client with mild fever, D, a client with fatigue. Answer B. Sepsis can rapidly progress to shock. Question 47. Which client should the nurse see first? A, a client with chronic cough, B, a client with severe hypoxia and confusion, C, a client with nausea, D, a client with insomnia. Answer B. Hypoxia with confusion indicates inadequate oxygenation. Question 48. Which client is the highest priority? A. A client with sore throat. B. A client with tension pneumothorax. C. A client with cough. D. A client with fever. Answer: B. Tension pneumothorax is immediately life-threatening. Question 49. Which client should be assessed first? A. A client with pain. B. A client with unstable vital signs. C. A client with nausea. D. A client requesting discharge. Answer: B. Unstable vital signs indicate potential deterioration. Question 50. Which client requires immediate nursing intervention? A. A client with headache. B. A client with airway obstruction. C. A client with constipation. D. A client with fatigue. Answer: B. Airway obstruction is the top priority per ABCs. If you made it this far, you're already training your brain to think like the Nclex wants you to think. Remember, when the exam asks who should the nurse see first, always think airway, breathing, circulation, sudden changes, and unstable patients. If this video helped you, like, share, and subscribe to MCQs Master 101 for more high-yield Nclex questions, priority reviews, and exam strategies. Drop a comment below and tell me which question challenged you the most, or what topic you want next. Until next time, study smart, stay focused, and keep pushing toward your RN license.